Hi, today I'm going to be talking to Phil Feldman. He works for SanData, and you all know that SanData is one of the vendors that takes care of billing and electronic visit verification for the state of North Carolina. So I've asked Phil to come and talk to us about some questions that I have and some that you all may have as well, because I know it from a high level point of view, but he's going to educate us just a little bit better on how, as a business owner, you can make the right choices, and also you are ready to implement that system once it gets started. So, Phil, why don't you go ahead and introduce yourself?
Great. Thank you very much, Patty. And as Patty said, I am Phil Feldman from SanData Technologies. I've been with SanData about 9 years. I'm a CPA from New York. I've been in home care for over 20 years. Started out at Gentiva Health Services in the finance department and worked my way through some operational positions there. Also worked at CareCentrix, which is a big referral source to home care, and was owned by Gentiva at that point in time that I was there. I left Gentiva to actually run a large home care agency in New Jersey. We had 13 offices in New Jersey, and then we bought another company up in Massachusetts. So I was vice president of operations for the adult non-medical division of that agency. We also had a pediatrics division. Then I came to SanData about 9 years ago to start the SanData Revenue Cycle Management outsource offering for SanData, and have been here for 9 years doing that. My title right now is National Director of Revenue Cycle Management. Very happy to be presenting to you today, and very glad that Patty asked me to join this call.
Thank you so much, Phil. I love that you were talking about the business cycle, because one of the first questions that I had for a business owner is that many companies that I work with are very small. They're getting started from the beginning. And I wanted to know, when should they look at implementing a system to manage their business? I know they have to have electronic visit verification if they're going to do Medicaid with the state of North Carolina. But what part of the cycle of their business is the best time for them to look at implementing a system?
Okay. My advice is as early as you possibly can. I know there's a cost involved, but there are benefits to implementing as soon as possible. So typically in the early stages of an agency's existence, it's best because this ensures compliance and allows for you as an agency to have the most efficient operating model supported by technology. It's also easier to implement a system in a smaller environment where you don't have the pressures of larger volume and the complexities, and you get the learning curve and the functionality in place to accommodate your growth as you get larger. Many agencies, out of necessity, launch without a system, or they're trying to utilize any technology that may be offered to them at no cost, as in North Carolina via the state EVV solution, for example. But the no-cost options offered by the states vary and are often centered around EVV, maybe some authorization management, some scheduling, and they often don't provide the agency with the robust features and functionality around items such as HR, full-featured scheduling, billing and accounts receivable, integrated payroll, e-learning, other efficiency gains, such as what we see a lot now of is artificial intelligence-driven shift booking. Many agencies can operate without a complete agency management system initially, but when you start to get to 40, 50 clients and above, the efficiency gains of a single process, single system delivers return on investment because it streamlines your workflows, creates operational efficiencies, creates revenue maximization through automation, production of clean claims, elimination of duplicate data entry, error reduction, edits, etc.
Okay, that's great. So you said as soon as possible. So some
Yeah,
of these agencies are very small. Do you all have entry level pricing? Because that's the one thing that a small agency really has to look out for is what are their costs up front when they're trying to get started. So how do you all address that if you want them to get started right away?
got it. So every vendor, Patty, has a different pricing model. Some are more suited for entry level and may be more a la carte, while others offer a more robust end-to-end platform. Many vendors price on a per client per month basis, which is Sandata's model, or a similar tiered volume structure. So that cost is aligned with your agency census. However, they typically there are monthly minimums and minimum term lengths. So Sandata does have a monthly minimum, um, but their pricing basically is on a per client per month basis. So you start out with a smaller cost and it's pretty affordable. And then it grows as your census and as your agency grows.
Right. So once an agency decides they're ready to do it, they want to go forward, what type of time commitment or resource are they looking at committing to that project?
Okay. So there are two things here. There are two elements here, Patty. One is elapsed time from beginning to end of the process. And that's typically from inception to implementation, go live is about 45 to 90 days. This can vary based on the vendor, but excuse me, it also varies based on the provider and what your needs are and your environment, what modules you want to use, what lines of business you have, your payer mix, etc. I would plan on a 90-day effort from kickoff to full use. So this includes initial discovery, what your environment is, working with our implementation team, setup and configuration, data entry. Don't forget your data has to be migrated from your old system, whatever you have, into the new system. Testing, training, very important. Ultimate deployment. And then you want to work with your implementer to oversee a full business cycle. Then you'll be relatively self-sufficient. You can transition from implementation to our support team.
So if an agency started out doing everything manually because they just didn't get started soon enough, what types of things should they be doing if they have to start off manual and they're going to go to a system later? Is there anything they can be doing internally to make that process go more smoothly?
In terms of implementation of a new agency management system, that's a huge undertaking. And what you need to be preparing for is to support that process. So with any initiative, as with anything, just like getting into the business, the more you invest, the more value and success you'll get out of it. From what we see, the biggest point of failure for new implementations that we do is insufficient focus by the customer. So what you want to do before you start implementing a system, and I would even do that before you start looking at systems and vetting new potential systems, meet as a team, ensure everybody is aware of the projected timeline, the effort needed to successfully implement a new solution, divide up the roles and responsibilities. If people come back and say, hey, you know what, I am really overwhelmed, I don't have time to do something like this, that's a concern. You may need to bring in temporary resources. Senior management may need to be more involved than they anticipated. If you're an owner operator, definitely something you need to think about because, you've got new cases coming at you, you've got issues, you've got applicants. If you're trying to do too much on your own, you'll never be able to really invest the time to work on a new system. So what you want to do is you want to define internally a subject matter expert. You want to have an executive sponsor to support that subject matter expert. Now, they could be one and the same, but typically, depending on the size of the agency, you might need both. We assign an implementation manager to every customer. So there needs to be a counterpart in the customer organization to ensure that your organization stays on track and continues to invest the needed time and effort. Training is very important. everyone is going to need to be trained in their area, and to engage our implementation team, providing data, supporting testing, doing the training, trying things out, et cetera, et cetera. And remember, when the system is new and the data may not be all up to date, everything is going to take longer than it would have taken in your old system until things get up and running appropriately. You need to organize all of your data. So something to think about as you're planning on implementing a new system is cleaning up your data. I know we're all busy. Data is coming into the system. It might not always be updated, but client and staff demographic information, authorizations, schedules, compliance documents, those types of things should be clean and up to date before you start migrating data into the new system. Also, you want to be thinking about what are your current challenges? What are your pain points? What are we looking to solve for the purchase of this solution? Because you want to be bringing that to the implementation people so that they can appropriately address it. Nuanced scenarios. So you want to ensure that the workflow with the new software meets your requirements. So you may want to, if you're looking at your plans of care, you may want to have certain tasks excluded from the standard list that's supplied by the vendor. And you may want to add specific tasks to the type of service that you're providing, or see if you have the ability to tailor a plan of care for the individual client. And there are systems that do provide that, but you want to make sure that you include that in their vetting process.
So Phil, excuse me, that is a
Right.
very good point on the plan of care and the task. So do most systems, or does your system have the ability to add tasks or exclude tasks that are not relevant to just that client, whether it's pediatrics, geriatrics, whatever? Is that capability there?
Yes, that's a request that has to come up during implementation, and then through time, that has to go through our support area, because those tasks would have to be added by our support area.
That would be a nice feature. I think that would apply to any of the clients.
Absolutely.
That's great. That's great.
So just to continue, no two systems are exactly the same. So you might not see feature parity across the vendors, but you can't compromise on the critical functions. So don't go live until you completely understand and agree with the operational outcomes coming out of the system. So are all the processes working to meet your needs? Do the screens and the reports make sense? In that same company that I was at, that I told you about, where I was the controller, the person who was implementing the system had a famous line, and what they said was, test, 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 test. So as many potential scenarios that you can test as possible. This also helps to familiarize your team with the system. So bottom line, if your agency is making an investment in a new agency management solution, whether it's the first time or a replacement for the system that you're already using, it's so important to complete all of the implementation related tasks completely and accurately. Ensure your information is clean going into the new system, garbage in, garbage out, and then complete the trainings. This is the thing I see the most often, is that the agencies, the staff doesn't have the time to do the trainings and hasn't created the time to do the training and to ask questions. So having a good understanding of how the system operates makes a world of difference in the return on investment potential, short-term and long-term. I see a lot of agencies fully implemented on the system, and they're not posting payments from the payers. So they don't know how to manage their accounts receivable. They don't know what claims are unpaid that they need to follow up. So to continue, I can't overemphasize the importance of assigning a project lead, somebody who is organized, empowered within the agency. Doesn't have to be an executive, doesn't have to be the owner. But as an executive, you need to be there to monitor and support these folks, and they need to be to feel comfortable that they can escalate issues to you. So you have to commit to the project and you have to properly research.
Okay, so one of the big things for all agencies is compliance. So we just talked about being able to tailor the system to make, if there's something you need to be tracking, how how much should an agency look into the features that help them to be compliant with their policies and procedures and rules and regulations?
Absolutely an all important question that should be asked during the vetting process. You definitely should be looking at multiple systems. You need to know what the rules and regulations are as a safeguard. You can't just rely on the vendor. So similar to my prior answer is knowing any critical or market specific needs is important to address during the process to evaluate a system. Review the North Carolina State website, understand the state and the MCO's requirements and any other payers that you have. So if you're billing VA, if you're billing Medicare Advantage, if you're billing a certified agency on a contract, you need to understand what they need so that you can address that during the process. So, certainly you want to be looking at electronic claims. How do we bill electronically? What do the claims need to include? What information needs to be out there? What are the vetting requirements for caregivers? So is there a do not use list? Does that have to be monitored by the system? So when looking at a vendor, it's really all about what's the level of experience of that vendor in the state. How many customers have they implemented to date? What sizes are those customers? Do they integrate with the selected EVV systems used by the payers? So even for SanData, the EVV application that is contracted by NC Tracks is not part of SanData's main system. So the SanData system that the agency gets still has to integrate with that EVV system, just like any others. And you also have, if you select SanData, you need to know that SanData integrates with HHA Exchange, which is used by most of the MCOs. So you need to understand the integration. Ask for references, talk to the references. Don't just get a list, call a couple of them. I've been in a lot of industries in my career, and of all the industries I've worked in, home care is one of the best for competitors helping each other out. Agencies are willing to help other agencies, and that's why you should always feel comfortable calling and asking the references questions.
Excellent. And my next question was, does the vendor provide any assistance to the agency upon implementation? And you covered that. You talked about having a point person on your end and a point person within the agency, and they work together. I think that's important. And I really think that's a good concept, because you do have two people that are supposed to know what's going on that communicate with each other, and there's not multiple people calling back and forth.
Exactly. So at SanData, we assign an implementation team with the disciplines needed, and there's a project manager who oversees the project that's going to be part of the onboarding experience from day one. Where we have a kickoff call, we give you a checklist, we give you a calendar, we tell you all the things that we need and when we need them. So we shepherd you through the entire process. It's very white glove. Some vendors are largely hands-off, while others are very hands-on, and they're engaged throughout the process to ensure that the project plan is adhered to. The support model, so post-implementation support, is very important, something to consider when you're questioning potential vendors. So support hours, what are the methods for support? So at SanData, we have a call-in number, we have a chat, we have, you can create your own ticket online. So those are things that are important, because it's, if the support is flexible, then your folks can figure out what's the best way for them. If they want to do something on the fly, if they want to call into a number and speak to a human being, what works best for them. And then even the costs after the initial implementation are also things that an agency exploring a solution should inquire about. So is there any cost? Do you get a maximum number of requests, maximum number of hours, et cetera, and make sure all of that appears in the contract.
Okay, that's good. So then I started to think about an agency that's already established and say they were with another vendor and they were deciding to change vendors. What are some of is it just you just have to get your data transferred over, or are there any major considerations that are there that you need to be aware of?
So, Patty, it's interesting because it's a double-edged sword. So sometimes you're better off coming into technology brand new. You've never used technology before, and you're working in a totally new world with a clean slate. And then sometimes coming in from other technology, you're used to technology, so you have adoption might be easier, etc. I've seen situations where adoption was harder because some of the staff was resistant to the new technology. They were used to the old system. Here's how we did it. Yes, it was more manual, but I understood it and I felt comfortable with what I was doing manually. So what you really need to consider is your organization, what's the time commitment that you're going to need, and not just a lapse time, but the effort during that period. So typically, as I said, it's 45 to 90 days on the average, even for an agency that was on another system. Could take even up to 6 months, depending on the size of the agency, the scope of the project, the complexity of your environment, etc. If you're switching from another system, you need to anticipate having that running for an overlap period for historical reference. So, for instance, authorizations, billing history, collect your old AR, because AR typically doesn't get migrated over to a new system. And then you need to continue to monitor and collect those old receivables. So you need to do a side by side also, looking at the reference screens and the reports that you were getting from your old system to ensure you know the equivalents in the new system and that they're there and that there are no gaps, that all of a sudden you start up day one and, oh my gosh, I need this dashboard, or I need this screen, or I need this report, and it's not there.
Okay, that was great. And that accounts receivables, that's huge.
Absolutely.
Because
Absolutely.
you're operating on, low volumes, low margins anyway.
Exactly.
And to have that outstanding, so that would be the first thing that I'd take a hook to and get control of that, because that could just blow everything out if it's not handled.
Absolutely. So, you don't want your cash flow to come to a grinding halt. Then how are you going to make payroll? So absolutely, you need to ensure that there's a smooth transition of your accounts receivable. And that's why you need to be looking at the edits, you need to be looking at the process, et cetera, et cetera.
That's a great point. Thank you so much for that. And one question that I've had is that I know that SanData has a free version for Medicaid clients in North Carolina. What are the major features that are not part of that free version? If someone only had that, what are they missing that you can do for them in your your fee system?
Okay. So, Patty, from a point of reference, let's start with which features are included in the free system.
Great.
Okay, so firstly, you're getting multiple visit entry methods. So there's a downloadable mobile app that your caregivers can use in the home. There's telephony. They can use your client's land-based telephone. Or if you're still getting paper timesheets, which you should try to get rid of as quickly as possible, you can manually enter the visits into the SanData system. Scheduling is in there. It's optional, but if you use it, it has benefits because you're getting basically a basic scheduling system, which is very helpful. You get a dashboard for visit management and maintenance. So you want to be sure that the visits that are exported to the state agree with the claims that are going to the payer. So because mismatches will be denied and they'll delay your payments. So this dashboard helps you highlight exceptions. It allows you to correct the visits. It allows you to add missing data, et cetera, et cetera. This way you avoid rejections when they hit the state of the visits themselves and mismatches with the claims. You get editable client and employee records. You get authorization management and maintenance, an enormously important feature. And then you can export your visits to NC Tracks, of course, and track your unexported visits to say, why didn't this visit go out? What's wrong with it? So features that are excluded from this that are provided by Sandata's agency management system, which we call our enterprise system, certainly, Patty, as you were saying, is very important. Revenue cycle management. So billing, electronic or paper, cash application, accounts receivable maintenance, HR and compliance, demographics, licensure, immunizations, in-service compliance, all of that is maintained in the system. Certainly payroll. Sandata provides a payroll solution, or you can have a file created that gets exported to your payroll provider, like ADP, Paychex, etc. You can support EVV for your MCO clients, integrated with their claims aggregator, so we can export the visits to HHA Exchange and your claims. You get e-learning, which is great because it's your caregiver in services they can do at their convenience on their telephone app. You get shift booking. So, for instance, the system will look at who is logical in your open caregiver database to take a visit, to take a case. And if you decide, yes, that's the person I want to use, it will automatically text that individual with the details of the case, et cetera, and they can just click a button and accept the case. So it saves the phone calls, saves all those other things that your coordinators are doing. Clinical documentation, there's an EMR embedded within the system. As we talked about before, plan of care entry, plan of care compliance tracking. So when your caregivers clock out of a visit, they enter into that against the plan of care, what tasks they have performed. Certainly robust reporting, all kinds of reporting, financial reporting, authorization management reporting, expiring authorizations, expired authorizations, scheduling mismatches, all kinds of great reports. And then there's an allowance for additional lines of business. So if you're doing private pay, if you're doing VA, if you're doing even non-EVV mandated payers, the system still supports that.
That's great. That's really a whole lot of features there that they can grow into as they need them.
Absolutely.
So that is really great. Well, Phil, this has been a wonderful conversation today. I appreciate all the information that you provided. I've certainly learned a lot. And I know that those who will see this later, you did a really good job with telling us what different systems can offer and that they're not all the same. But from an owner standpoint, I think someone could listen to this and know that they really need to be aware of a lot of things if they're going to implement a system and to make a really educated choice.
Absolutely. And I would recommend, if anybody has any specific questions, if there's anything that we didn't cover that is of concern to them or of interest to them, have them reach out to you. You'll reach out to me so that you gather all of that data and can provide it to all of your membership. And everybody gets the benefit of that information. Happy to answer any questions at any time and participate in any future calls.
Thank you so much. We really appreciate it.
Pleasure.